office at Rich for the third informGhana Hangout. This is going to be on Ebola and cholera, and we are lucky to be joined by a public health service officer. I will let him go ahead to introduce himself, then we begin with the Hangout. Sir.
Okay, thank you very much, and greetings to my cherished listeners. Dr. David Opare is my name. I'm a public health specialist with the Public Health Division of the Ghana Health Service.
Okay, sir. Could you kindly tell us what causes Ebola?
Good. Ebola per se, Ebola virus disease, is a disease which is caused by a virus, Ebola virus. It's in the RNA group, and then basically it kills very fast. It has high case fatality. What does it mean? It means that if a group of people get a disease, most of them will die, about 90%. It has high case fatality. Ebola virus disease, basically the signs and symptoms are said that it's sudden onset of fever, vomiting, diarrhea, internal and external bleeding, sometimes abdominal pains, and diarrhea, etc. But most often, you don't get all these signs and symptoms before you arrive at the point that it's Ebola virus disease. It can be 2 or 3 symptoms, but before you are aware it's Ebola virus disease. It is transmitted by close contact with infected people, like body secretions, like sweat, like diarrhea, and the stool, the vomitors, sputum, etc. So it's transmitted by close contact with these things. And basically, if somebody has Ebola virus and the dresses that the person wears, etc., you come in contact with them, you have the chance of getting yourself infected. And better still, you know that this Ebola virus disease, we said the reservoir is from a fruit bat. Okay. So the fruit bat, not the other, but the fruit bat. So if anyway, maybe the bat eats some fruit, etc., and you come and you eat that particular fruit also, stand a chance for getting that particular disease. So Ebola virus disease is a disease which kills very fast, and it has high case fatality. And it's said that the close contact with body fluids, etc., can easily get a particular disease.
Okay, so we've heard of Ebola outbreaks in Liberia, in Nigeria, and now a lot of people are worried that we could have an outbreak in Ghana. I want to know what the Ghana Health Service is doing to contain this outbreak, and in the case Ebola, we should have an Ebola case in Ghana here. What will be the response of the Ghana Health Service?
Thank you very much. Before I come to the response plan that we have in Ghana, I must say that in Ghana so far, we've tested, as of today, 62 samples have been investigated or tested in the language, and they are all negative. Okay. So Ghana per se, we haven't recorded any Ebola virus disease. Good. And what is Ghana doing to? We have a response strategy, and this. So there's an NTCC, that's National Technical Coordinating Committee, which is chaired by the Health Minister. We have a response strategy. They're in blocks. We have the social mobilization and health education strategy. We have the case management and funnels. We have the surveillance and epidemiology laboratory. We have logistics and security. We have the media, the coordination, and environments. So all these things, we have different activities under all these blocks. If you talk of maybe surveillance, disease surveillance epidemiology, we have like contact tracing, case finding, sample collection, report, etc. So all these blocks have their various small activities to address Ebola virus disease. So this is what we have now. And we have committees and all the people that's involved to address all this. And we have a rollout plan. So like we talk of health education, for instance, nowadays you go to the media, hear everybody talking about Ebola. Simple messages for people to adhere to so they don't get themselves infected. Talk of case management too. Health workers are being trained so that at least they can know how to manage the cases and not get themselves so infected. Barriers, etc. All people are being trained so that in case you get Ebola, how to bury the body is done in such a way that people don't become infected. Because if you are treating somebody, that means that you care for a patient or you treat a patient, you yourself become infected. logistics to be able to investigate that there's Ebola case. At least some people must go somewhere in the laboratory to investigate the case. So in terms of logistics, reagents, who to do it, and even how to transport the specimen from maybe hospital A to hospital B for people to test. All these things are being done. Furthermore, how people can get themselves protected, like the dress that they have to put on, because something PPE, personal protective equipment, like put on gloves, put on goggles, put on apron, put on mask, etc., shoes, all these things, so that people don't become infected when they are managing such a deadly disease which is called Ebola virus. So I'll say Ghana, we have a response team, and all the communities are working actively so that we don't hope to get a Ebola virus disease anyway. But in case something happens, I think the response strategy is on board.
What can I, as an average citizen, do to help the fight against Ebola?
Okay, first, I think the information should go down very well about the causes and signs and symptoms of Ebola. First, in a simple thing, you know that if somebody is suspected of Ebola, please don't get in contact with that person. The best you could do is to report to the nearest health center. Fine. And a simple thing, body contact. So issue of handshaking should be restricted, because in our culture we love shaking hands. It's good. And at this time that we are in the Ebola era, it is recommended that we should minimize handshaking to the barest minimum. And if it takes some time, changing people's behavior is not a matter of a day. It takes some time. So gradually people should adhere to the fact that handshaking, which was being practiced yesterday, today we have to put a stop to that, because it's said that it has a lot of benefit. Because simple hand washing, if you're able to stop handshake and wash your hands very well, you can reduce a lot of infection which is transferred from the hand. And hand washing is also very key, because you're able to wash your hand very well. Apart from being able to reduce the spread of Ebola, you also reduce the spread of other diseases also. So hand washing should be done, and done properly. It's not a matter of taking a bowl of water and soap and wash. No, you should wash your hand under running water, which is key. Of course, not all places do have running water, but try as best to use running water. You can let someone pour the water on your hand to wash it. So you see the same bowl, wash your hands several times. And also, we have something called hand sanitizer. It's a very small thing, you can buy from most of the pharmaceutical shop, etc. At any time, Dr. T, the moment Dr. M, make sure you have one on you. So that any time you suspect your hand is contaminated, use it to clean your hand, and it can kill a lot of microorganisms on your hand. But this time that you are promoting hand sanitizer, let's be careful of the fake hand sanitizer in the system also. Let's make sure you buy the hand sanitizer from a recognized pharmaceutical shop and chemical so that you don't buy this thing. Also, let's make sure that we don't come in contact with contaminated dresses, etc., from infected people, because by so doing you can also get yourself contaminated. And let's also make sure that this issue of that the virus, the reservoir is in the bat, fruit eating bat. Fine. So issue of bush meat should be something in the past. Let's nip bush meat eating in the bat. Yes. And the issue of fruit bat, in the bat, we're not supposed to eat the bat anyway. But some people say that, it is fruit eating bat. Others say, no, this one is ant-eating. No. Bat is bat, because if someone is selling bat, it is not written on the face of the bat that this one is from the fruit, or this one from the ant. So bat is bat. So let's make sure that we don't eat bat. It could all bushmeat, because the virus, the reservoir is in the bat, but it can be a host in other animals, like the pigs, the antelopes, etc. So let's be very, very careful about Ebola virus disease.
Thank you. Doctor, even as we are trying to contain Ebola, there have been reports of Ghanaians dying out of cholera. We would want to know, what is it that causes cholera, and why have we been suffering outbreaks of cholera several times over the years?
Okay, thank you. I think cholera per se. First, we're talking of Ebola, a virus.
Yes.
Now, you move to cholera, a bacteria. Of course, they are all small microorganisms in of your eyes to see. Cholera is caused by a bacteria. The white man has named it Vibrio cholera. That's the causative organism. Good. Basically, it's fecal aura. What is fecal aura? If your hand is or food or water is contaminated with fecal matter, that's where most of them you get the cholera. Sense instance basically is vomiting and diarrhea. The type of cholera diarrhea is said that is plenty in simple language.
Okay.
Plenty, profuse, and goes because you are losing a lot of water from your body, you tend to become weak because a lot of water, fluid, is coming from your body. So cholera paste, apart from the losing of water and then the vomiting, become very weak. If you don't take it, we can get to a state that we call it shock, and if you don't take it, you die. It's fecal aura. So if the water that you are drinking, the food that you are eating is contaminated with this particular germ bacteria, you stand a high chance of getting cholera, and you can die very fast. Ghana, as you recorded cases of cholera, and you've confirmed cases of cholera, and then we are doing a lot. As I said, cause of cholera, poor sanitation is key. It's very key. And if you look at the environment, nobody will tell you that you have all the enabling factors that will warrant cholera coming. So I think sanitation is key, and sanitation is everybody's business to make sure that we get good sanitation around us. So in our own small way, just your environment that you are staying with, make sure that you have improved sanitation. The little bit that you can do it. That at least you can get good environment. We know that sanitation is you have a department that deals with sanitation, but we as an individual have a long way to go to make sure that we have. And furthermore, this time the food that you eat and what that you drink, need food that you're about to eat and the what you're about to drink. Ask yourself, is it safe? Is it clean? You are drinking water, you are buying water. Ask yourself, is the water I'm drinking, is it safe? Am I getting water from a good source? Because if the water is contaminated, as I said, you can get cholera. And the food that we are eating too, ask yourself, in times like this, we recommend hot foods. Hot foods are recommended. I'm not saying too hot, but hot in general, hot foods are better than the cold ones. And hand washing is very key. Hand washing is very, very important. And hand washing, as I said, wash and wash well. Anything that must be done well. Wash your hands very well with soap and running water. So at least you stand a high chance of getting rid of most of this thing. And furthermore, if in an environment and somebody is vomiting and has diarrhea, this can do him good by taking him to the nearest hospital for treatment, for management. The hospital we have competent people there to manage the case. And furthermore, I think the health education go on very well. We should tell people the signs and symptoms of cholera and the simple messages that we need to do for people to understand and appreciate the causes. The message, I mean, like everybody's duty. Now that you know the information, tell your family, tell your brother, tell your sister that now some people are saying that if you want to wash your hands properly with soap and then running water. Have hand sanitizer around you. Anytime you feel your hand is contaminated, you need to clean your hand. It will kill a lot of microorganisms from your hand. And also, when you buy your food, if you want to buy a food, ask yourself, look at the process of the food, look at the environment, where the food is being sold. The same hand using the money, the same hand using the food, the fingernails is not good, everything is good, it's splitting. Please, all these things will tell you that, please, the food that you're going to eat, it has a higher chance of being contaminated. Flies can be on the food, fly to on the food. Make sure that flies don't step on your food. They are all possible sources of spreading the bacteria. So all these simple things must be done. You should spread information in churches, in schools. It's everybody's business. Though there are some authorities who are involved to make sure that we have good sanitation system, but everybody's business to make sure that we get good environment, improve sanitation, get good drinking water. So at the end of the day, we don't become infected with cholera.
Okay, doctor. You've told us what we as individuals and the general public can do to prevent cholera. But I want to know what is what are the specific measures that Ghana Health Service has put in place to control the recent outbreak?
Good. What Ghana Health Service has put in place? We are managing cases. If you go to most of the hospitals, very good health workers are managing the cases, case management. Because if you don't manage the cases very well, they will die. Where we need to isolate, we are isolating them so that they don't become infected. They don't infect other people using all the necessary precautionary measures that we are doing. Health education also spread information. We're educating people what to do and what not to do. Furthermore, we are liaising with other agencies. Health is not a single person's business. It's totality. It involves a lot of people to be able to give good health. We are involving the various agencies, these assemblies, water sanitation, etc. All of them. Make sure that everybody will do his little bit so that at the end of the day, we don't get cholera. So we are involving all of them. We have a lot of, at the various level, we have committees that in times like this we activate.
Okay.
At the district level, the regional level, the national level. We have committees. Then times like this, we activate those committees to work very well and address all these concerns.
Okay, sir. Is there anything we can do? I mean, by we, I mean media that we can do to help the Ghana Health Service in this battle against Ebola and then cholera?
First, the media, I must thank you. You are doing very well. Later we come to you, give us free airtime. We are very grateful to you. What you can do is still continue to give us free airtime for us to spread information. Because most of we give some leaflet out, some simple health educational messages. So we want you to be, reading to people every now and then, the do's and the don'ts. So at least, changing people's behavior is not a one-touch thing. You must keep on saying every now and then, so that they get. Initially, some people may not be, but as you keep on coming, churning out the information, wash your hands very well with soap and running water, eat hot foods, make sure that etc. People get to understand. So I think this is some of the things that you must do, and at times to make sure that you get the right information from the right source, so that at least the right information is given out to the public. So at least they will know that at least the information is from the right source, credible source, and then people will appreciate it and use it, so that at the end of the day, the cases will go down.
Thank you very much, Dr. David Opare. We are grateful to have him with us. If you need more information on Ebola, you can simply text 1943 on any text Ebola to 1943 on any network, and then you'll be provided with information on Ebola with veritable sources. Once again, I would like to thank Dr. David Opare for taking his time out of his busy schedule to join us for this hangout. And if you want more information on informGhana, you can visit informghana.com. For our various social media platforms, you can just Google informGhana, no spacing, and then they will all appear there. Thank you for joining us and have a good afternoon.
Thank you also.